From here on, Ijema starts to talk about warm febrile diseases. Now he talks about warm febrile diseases interchangeably with liver heat causing internal heat syndrome. Why? Because the liver heat causing internal heat syndrome is a manifestation of warm febrile disease. Okay, so the herbs that he uses for warm febrile disease are also the herbs that he would use for liver heat causing internal heat syndrome. They're one and the same, except epidemic disease or warm febrile disease, he would use strong herbs depending on the severity, the acuity of the epidemic. When we talk about warm febrile disease, we are talking about epidemic illness. So we are talking about sudden influx of heat within the body. And in the Taeyam's case, it's the liver. Okay, so I'm going to skip a few paragraphs here and get to the paragraph that starts with Gongjin continued by stating, okay? The reason why I'm starting here is because the other paragraphs describe at the time, what the pulses, what the symptoms were like, and what the prognosis was like for warm febrile disease. So if you have a chance, please read this on your own time. But for the purpose of this course, we're going to just continue onwards to the core of what Ijema's thoughts and prescriptions are. Gongjin continued by stating that in the year of the third stem in the 11th branch, when he resided in Dalian, many farmers died after contracting an extremely prevalent form of epidemic illness, which was characterized by chills and severe fever. Okay, the chills is the body's attempt to ward off and close off the pathogen from getting inside. And the fever is once the pathogen gets in, the body tries to fight it by heating up. Okay, with swelling and redness in the head, face, nape of the neck, and cheeks. These individuals also suffered from sore throats and swelling and muddled consciousness. At this time, he discovered a remedy called Ershen Jukuwan. Ershen Jukuwan. Er means two, Sheng means saint, Ju means to protect or to rescue, okay? Ju means to rescue, okay? Ku means suffering, and Wan means pill. So the two saints rescue the suffering pill. And in this, we see here, which consists of 225 grams of Da Huang, which is the rhizoma ray, right? And 75 grams of Sao Jiao. Gongjin prepared this remedy by grinding it into powder and shaping it into green pea-sized pills. After ingestion of 50 to 70 pills, sweating will occur without fail. Remember, once the Taeyam sweats, that means that they are starting to recover from the illness. Even after one bout of sweat, recovery will be imminent. There was a 100% chance of recovery amongst those who originally had a strong constitution. An amazing formula, isn't it? Xiao Jiao is capable of opening the orifices and expelling external pathogens. So working in the upper body, right? Da Huang sedates fire and promotes interior flow, working in the interior body, at least from a TCM perspective. But also, these herbs work in a similar way in Sasang medicine. Xiao Jiao clears heat from the lungs. Where is this lungs heat coming from? The liver as it rises upwards. Da Huang is used to clear heat from the liver itself, and also as the liver heat transfers over to the intestines. Right? The small intestine and the liver are of the same system. Okay? So similar ideas, but slightly different energetic properties. Ijema uses, we're going to talk about this in just a little bit, a similar formula to Ershang Jukuwan. He acknowledges that these two herbs are for the Taeyam individual, and they do help the function of the liver and lungs. Except he modifies this a little bit. Jogak Dewangtang. Jogak is the same thing as Sao Jiao. Sao Jiao is the Chinese pronunciation, and Jogak is the Korean. Daehwang is Da Huang in Chinese, Daehwang in Korean. So Jogak Daehwangtang. Okay, so what does he add here? Ijema adds Shengma and Gugen. Shungma and Gugun are in almost every heat clearing formula for the Taeum individual because they are so good, they work really good together, and they're so good at clearing heat. Gugun is the number one herb in Sasang medicine to clear liver heat. Shungma helps clear the heat and pushes it out to the surface, okay? So, and beyond the surface. So, skin-related diseases, swollen cheeks, like mumps, measles, pushing out the pathogen through the skin so that it doesn't get stuck at the surface, okay? And cause boils or measles, mumps, etc. Okay, so that's how shungma works. And so shungma, gugun, dahwang, jiao. Exactly the same as ersheng jukuwon, except for the fact that dahwang and caojiao have the same dosage, and shungma and gugun are added to clear more heat. One clears more heat from the liver itself, the other helps clear heat from the surface of the body. Next page. Unseasonal weather may lead to excess phlegm and saliva, headaches and body aches, chills, fever, with swelling of the throat and eye pain. In such cases, the appetite is not affected and life carries on as usual. If in severe cases, however, the throat will be so swollen that speech is impossible, the eyes will become red and swollen, mouth sores will form, as will boils will form on the cheeks, throat B syndrome will occur, with sneezing and coughing with copious sputum. This B syndrome is congestion of the throat, so phlegm getting stuck in the throat. Okay, so we're talking about basically liver heat causing internal heat syndrome times 10. Okay, so very, very strong liver heat situation suddenly brewing within the body. From my perspective, if the above syndromes are accompanied by strong chills, excessive fever, and hard stool, then 조각대왕탕 should be used. Hard stool because the heat is drying up the stool, okay? And the chills is because the body is trying to fight off the external pathogen as well. So there's some remnant, when it comes to epidemic disease, a lot of the time there's some remnant of the external pathogen, okay? So in the Taeum's case, the cold. Or kalgun seungitang, okay? Kalgun seungitang we talked about before. Kalgun seungitang is a really, really great formula to help promote bowel movements. Kalgun seungitang is a formula which is really good at helping promote bowel movement. And for the Taeum, promoting bowel movement helps clear liver heat because the liver is associated with the intestine, especially the small intestine. So liver heat getting trapped inside the small intestine will cause the stagnation of an accumulation of the stools. So helping promote stools for the Taeum and for actually all the other body types, but especially the Taeum, helps clear heat, okay? Heat stagnation. So, kalgun seungitang, we saw it before. Gugun, Hongqin, Dahwang, Shungma, Jiegung, and Baizhi, okay? These formulas should also be used if there is redness and swelling of the head, face, neck, or cheeks. So in cases of, for example, mumps, measles, right? Any type of swelling of the face, okay? That is due to heat. With fever, fullness of the abdomen, and diarrhea with excess heat, it is classified as internal illness and should be treated with kalgun haegitang. Okay, so what's the difference here between kalgun seungitang and kalgun haegitang? Right here. Fullness of the abdomen and diarrhea with excess heat. Okay? The difference is constipation or diarrhea. Okay? kalgun seungitang, we have dry stools. Kalgun haegitang, we have a loose stools. Okay, now is this loose stool the typical diarrhea we see in cold syndrome? No. This is still a form of constipation. This is a form of heat stagnation. So in other words, this loose stool will usually be lighter in color. It might be burning. There's some discomfort with passing, and it might be incomplete. These are all signs of heat accumulation inside the body. But with kalgun seungitang, we're using it for constipation. For kalgun haegitang, we're using it for diarrhea. Now, this is how Ijeoma describes it in Dongyu Sebon. In the modern day clinic, in my clinic, we use kalgun haegitang pretty often for situations where there is a swelling of the face, redness of the eyes, pimples that form on the upper body, like acne, for example, in teenagers because their liver heat is rising. Yangming type situations, okay, where there's some bowel issue too. Now, I use kalgenhegitang for if there is some mild constipation as well. But I will use kalgensungitang to get the bowels moving as soon as possible. So kalgensungitang has more dahong and it is much more powerful at getting the bowels moving. Kalgenhegitang is not as powerful as the bowels to get the bowels moving, but to clear heat from the upper body, it is very powerful, even more powerful in some cases than kalgensungitang, okay? At ridding the body of swelling and redness of the upper body. If the above symptoms are accompanied with exterior illness and excessive cold syndromes, an extremely acute situation exists and should be treated with Taeum Joitang, with added Shengma and Huangqin. So remember Taeum Joitang? We use the Taeum Joitang for the cold-induced disorders, right? We have Yi Ren, Gan Li, Lai Fuzu, Wei Zu, Mai Mendong, Shi Changpo, Jiegung Maha. This is a really great formula for cold-induced disorder. So esophageal cold causing exterior cold disorder. So why is Ijima using cold-induced disorder formula when this is a warm feeble disease? Because there is extreme chills, okay? And that means that we want to treat the source first for the Taeum. We want to make sure that we clear this extreme cold, this chills that we're having. So this is the formula we'd use, but he's saying, well, there's heat, and we need to acknowledge the heat. So the cold is the root, the heat is the branches, and the branches we are going to treat with Shengma and Huangqin. This actually becomes a formula named Sung Gum Joitang. So this Joey is the same Joey as here. It means regulate the stomach. In Chinese, it's Tiao Wei. Okay. Sung Sung is from Sung Ma, which is Sheng Ma in Chinese, and Gum is the Gum of Huangum, and in Chinese Huang Qin. So Sheng Ma, Huang Qin, regulate the stomach decoction, and that's Taeum Joey Tang added Sheng Ma and Huang Qin. Why? Because we want to clear this heat. The root is the cold, the heat is the branch. This is a good way to treat somebody who has excessive cold symptoms and excessive heat symptoms, mixed internal and external disease. I once treated a Taeum individual who suffered from internal liver heat due to the onset of a warm feeble disease. For several years prior, he also suffered from chronic insomnia, contributing to the onset of internal liver heat. So, lack of sleep can contribute to the onset of any illness, right? Here, in this case, this particular person is prone to heat-related situation. So the lack of sleep is causing his internal liver heat to stir up, okay? And it can also cause more vulnerability to warm feeble diseases, okay? From the first day of his warm feeble disease, I prescribed Yolda Hansotang. And after the 3rd to 5th day of ingesting these herbs, he had reddish diarrhea. So he's clearing heat from his stool, right? On the 6th day, he was not able to have a bowel movement. Too much heat, drying up the stools. So I prescribed 3 days of kalgensungitang. The bowel mover formula, right? Clearing heat through the bowels, okay? After he ingested this formula, his appetite increased significantly. After 3 days of ingestion, and his heat-related symptoms greatly improved. Following his recovery, I prescribed Yoldahansotang, greater heat and lesser cold decoction, but his stools again began to get dry and hard to pass. I then either added or omitted 3.75 grams of Taohang, depending on whether he was constipated or not, or his stools were too loose. I continued to attend his illness for another 20 days, leading to full recovery. Yoldahansotang. Yoldahansotang is greater heat, lesser cold. Do you remember Handa Yosotang? Handa Yosotang is greater cold, lesser heat. This is the opposite of that. So this is a situation where liver heat is the root. Okay, there may be some cold symptoms, but liver heat is the root. The other 한다여섯탕 is where cold is the root, even though there may be some heat symptoms. 한다여섯탕 is used for long-term colds, people who are subject to colds quite frequently, a cold that tends to linger into cough. 열다한소탕 is for more heat-related symptoms. Okay? So like a constipation, for example, fever, liver heat. So we're talking about 정 imbalance of the 정 emotion, right? Which is complacency, right? So this is all 열다한소탕. So when does somebody use 열다한소탕? Usually when there's an onset of heat-related situation, okay? Where they may even have some chronic heat. For example, they have gas in the stomach. Now, if somebody has gas in their intestines or gas in their stomach, if they have a heat syndrome, that means they can continue to eat, okay? Even though there's some discomfort. If they have cold syndrome, they cannot eat, okay? Because that gas is inhibiting the ability, the cold stagnation is inhibiting the ability to digest. Okay, so for 열다한소탕, they can have some bloating and gas, but still have an appetite. 열다한소탕 will clear the heat away. Okay, 열다한소탕 is not very powerful at moving the stools, and that's why 이재마 used 갈근 승기탕. But he used 갈근 승기탕 only for a short time because he was afraid about he was cautious against using too much dahwang, right? 7.5 grams. Too much dahwang can in and of itself eventually cause more dryness, right? So he wanted to be very careful about that, and he moved back to 열다한소탕, but he also added dahwang to 열다한소탕 in a lower handon, which is 1 don, 3.75 grams, right? So that he was not going to injure this person, and instead support them by clearing the heat gently, okay? So he used it on 갈근 승기탕 for only a short period of time, went back to 열다한소탕, which you can actually prescribe for a longer period of time, weeks if not months, okay? Without injuring the patient. So what is 열다한소탕 plus dahwang? 열다한소탕 plus dahwang is 정, 폐, 사, 간, 탕. Okay, in Korean, 정, 폐, 사, 간, 탕. What does 정, 폐, 사, 간, 탕 mean? 정 means to clear, okay? 폐 means the lungs. So this is now we're seeing lung accumulation, lung heat accumulation coming up from the liver as a result of liver heat coming up, okay? Coming upwards. 사 means to reduce. 간 means the liver. 탕 means decoction. Clear the lungs, reduce the liver, or sedate the liver, decoction, okay? And what is the difference between 정폐사간탕 and 열다한소탕? Only the addition of dahwang to 열다한소탕. It becomes 정폐사간탕. That formula is used very, very often in the clinic with heat-related signs and symptoms with sluggish bowel movement. Okay, whether it be periodic diarrhea, dry stools, this formula works great. It does not work as good as 갈근 승기탕 to clear the bowels, but it is a very good formula and a very safe formula to take over a longer period of time, and also for chronic heat symptoms, okay? Chronic heat related symptoms, chronic irritable bowel syndrome, chronic Crohn's disease. 정폐사간탕 can also be used for clearing heat from anywhere in the body, like chronic headaches, for example. 정폐사간탕 is very good for that if it's related to heat situation, heat disorder. During the early stages of this illness, this patient experienced an upset stomach, vomiting, muddled consciousness, and unbearable aches and pains. This situation improved as time went on, and by the 12th day he completely recovered. I once treated a 10-year-old Taeyum individual who suffered from internal liver heat and contracted a warm fever disease. causing a total loss of appetite and inability to ingest herbal medicine. It's very serious liver heat. Usually with liver heat, you can still ingest food, you can usually digest, but if there's way too much heat, then even in a heat situation, there's no appetite. His heat syndrome was so acute that he continuously drank cold water. He first experienced 11 days of sporadic constipation, and then 4 days of absolutely no bowel movement whatsoever. In his anguish, he began to hallucinate and complained of bugs piling up in his room and mice crawling within his chest. This is all due to excessive liver heat bombarding the head, so exploding upwards. He would then lie on his stomach screaming and crying. Occasionally his fever would decrease and he would contract Feng syndrome. Feng means wind, so internal wind stirring. What is this? It's spasms, tremors, loss of consciousness, psychotic behavior, and stiffness of the muscles and extremities, leading to extreme coldness of his hands and stiffness of his legs, making it impossible for him to bend his knees. I immediately prescribed 갈근승리탕, by forcefully opening his mouth to pour the medicine in, despite the fact that he was crying frantically. He had no choice, right? How else are you going to get the medicine down? From that day onwards, his appetite increased significantly. His epidemic illness greatly diminished, and his life was fortunately saved. How many times have you, as a parent, if you are a parent, did something which really created so much anger, hostility in your child? You know, it must take such a leap of faith to do something that you know the child is not going to like, and scream and rant and rave, and but still do it. Especially if this child was not Ijema's own. So, you know, it must have been really hard for this child's parents to see Ijema forcing this child to have medicine against the child's will, and with lots of screaming and carrying on. So, yeah, Ijema was definitely somebody who believed in what he did. During the first 4 to 5 days of this illness, his appetite didn't change, and he was able to carry out his daily affairs, appearing as if he were healthy. His symptoms became more serious towards the end of the illness, from which he recovered in 17 days.